In order to reduce medication errors, I find it very important that nurses have a thorough understanding of this content. I currently work in the ICU and I manage patients with multiple medications daily. Through managing multiple medications, I have learned there can be many different interactions and that each patient can react to medications in different ways. Pharmacokinetics is the core subject of pharmacology and is a study of drug absorption, distribution, metabolism, and excretion. I had a patient the other day that was on dialysis and they were unable to properly excrete medications due to their insufficient kidney function. Considering some medications are excreted through the kidneys, I had to be careful with medication administration. In this situation, I knew their renal insufficiency caused them to be more prone to overdose and allergic reactions. When considering what drugs um, do to the body, or pharmacodynamics as it is often referred, the renal failure patient I was caring for presented a great example as well. This patient faced hypertension and fluid overload and was given Lasix, and considering this is a loop diuretic, I knew it forced a higher concentration of salt out of the blood and into the urine, causing diuresis. For this patient, fluid and electrolyte levels were also important to consider. I have not personally experienced a situation where pharmacogenetics was a factor in medication administration, considering these studies are very costly. I'm very interested in this part of pharmacology though, and I find that it may be helpful in situations where patients have multiple allergies. It also may be helpful for patients in need of chemotherapy, and it could help determine what chemo their cells are more susceptible to. In the patient example I provided, pharmacogenetics can be used to determine what diuretic works best for them, and it could have helped more with their fluid overload on days they were not scheduled to receive dialysis. Overall, I find this content to be very interesting, and it is important to consider all of these principles when administering medications.